Hello. Hi, Terry. Hi, Esta. Claudia, good morning. I am happy to be here. This is actually my week off of teaching. Usually I teach 8 weeks on and 1 week off, yet this is a class that I miss often. So I said, okay, that's it. I'm going to go away after this class. So I'm going on a little excursion, but I wanted to show up today and teach this class because what we do every day matters. And we need to do something every day. And so I took a lot of time off at the holidays and I noticed it. So I wanted to definitely be here with you all today. Lynn, hello. All right. Those of you that are here, are you in my community, Stronger Bones Lifestyle? So that is a place I'm showing up. I'm really excited. I have this month in March, there are 2 live Q&As, Ask Me Anything. There's also a live cooking class on protein, which is going to be really, really an important nutrient for us for bone health, right? There's 2 things. You have to eat the building blocks of bones, and then you need to every single day demand more from your bones, work on having stronger muscles for stronger bones. And then the other thing, the surprise that's going to be this month is we're going to have an orthopedic surgeon, one of, I believe, America's top bone doctors, in our live Q&A at the end of the month. So if you're not in there already, I recommend you join. That is here. Let me give you the link to that. It's on my website. Also, just a lot of great podcasts are coming out. Lots of exciting stuff. Definitely my mission is happening. I'm going to expose that we've been doing it all wrong for 30 years and empowering women to do all they can for their bones. And so those of you that are here, awesome. Glad that you are here. And anything before I go over to my mat, anything you'd like to ask or say or comment about. If you're not subscribed to my channel, please subscribe. And then if you like what I'm sharing, share this with somebody that needs to see it or hear it. We need to spread the word and have more women understand that there is so much they can do for their bones and actually should do for their bones. Because if we don't get involved in our bone health, and I don't mean taking a pill or a medication, and I don't mean just supplementing, if we do not get involved with our bone health, we will get weaker and weaker and weaker and be at a greater risk of fracture. And that is where everything is in the not great zone if we get a fracture. Hi, Carolyn. Hi. Wow. I don't know how to, there's a lot of symbols, but anyway, hi. All right. So I'm going to go over there and begin, and I won't be able to chit chat with you until the end. So let's begin. Let me make sure we're not going to be disrupted. Perfect. Okay. All right. So for today, Stronger Hips is the name of the practice. Don't be discouraged if you see that and you think, oh no, is this going to be a tough one? It's going to be whatever you need it to be. And that is something that's really important. You make it available to you. What is right for you? Because this is your body, these are your bones, and you need strong muscles and strong bones to have a healthy, happy, active life. So do what you can, go to your edge slightly over, I say. And you know what? If today's a day you're not feeling like you want to go strong, then just show up and go medium, or even less than that. Whatever it is, be here, be in acceptance of today, right now, right here. You're here to practice. Be in that place. And then let's see what happens from there. All right? So for today's practice, a blanket, a strap, and a block are the basics. And I have a wall. I think I'm going to use the wall today because when I do a practice for hips that requires strength, the deeper I go and the better aligned I am in my hip complex is going to be what stimulates the maximum stimulation for my muscles to get stronger. And then in turn, that's what strengthens the bones. It really is this relationship of what do the bones have to manage every day? And the stronger your muscles are, is what leads to stronger bones. So really stronger leg muscles are critical. So when we talk about stronger hips, we know we're going to do a lot down here for the muscles down here. The glutes, the quads, the hamstrings, working on that core for trunk support. So that is the area to focus on. And I'd like you to think of it that way. If this is what I want to protect, then what's around this that I need to strengthen to make be as dense and strong as possible so that it will then in turn support here. So that is the awareness. And again, for me, all of this is I want to give you the tools to be your own yoga therapist, your own physical therapist, your own chiropractor, and understand your body in a really deep way so that you can keep it safe as you strongly stimulate muscle and bone growth. So let's begin by doing a chest opener by getting a little bit of spinal correction to come into our body, a shape of a back bend. Take your blanket and take it the long ways, and let's roll up the blanket. Now, if you have something else that you're going to put underneath your chest for spinal extension, for a back bend support, you could use blocks or props. Something else that you'd like, this actually is a really great thing to do because it's enough height off the ground that then starts to open the chest muscles and the spine, which is really important for bone health. Now, when you come down, you want to make sure you maintain the length in the front of your spine, not collapsing, and bringing yourself down onto the blanket. Keep your eyes open at first. You just got here. You want to allow this to come in safely before you go too deep, before you go to a place where your nervous system is triggered or stimulated. Come here with the eyes open. And then notice what you notice. Look around you, noticing what you notice. Lift your head, lengthen the back of your neck, and then start to bring yourself into a position where you feel an appropriate and deep stretch in the upper part of your body. This is posture, spinal alignment, really critical for bone health. The upper arm bone, so from the shoulder joint to the elbow, that's your upper arm bone, the humerus bone. If you raise it higher, it'll be a little bit more of a pull in the shoulders. Now, those of you that have torn rotator cuffs or any shoulder issues, keeping the eyes open, explore what feels appropriate. If you do have a current tear or issue in your shoulder, I wouldn't go too deep because you're going to poke the monster of pain and potentially aggravate the tendons in that area. Lift your head, lengthen the back of your neck, and then let your arms rest. Your eyes are still open, bent knees, flat feet on the floor. So give your low back a little break here as well. And then your eyes are open, but I want you to keep going back and forth between what you're being stimulated by with your eyes open and then what is in your body. What are you feeling in the chest and in the shoulders? Noticing that, noticing what you're feeling and experiencing. Lift your head, lengthen your back neck. Now bring your awareness to your head and do a little side to side first, especially if you have the rolled up blanket. And if you're not doing that now, I recommend that you try this, that you have a blanket that's thick enough and that you could be long with so that your head, your whole entire spine could be supported. Because the blanket starts to go down and with the eyes open, the head going side to side, you're going to start to feel that stretch in the muscles that help to support your head on top of your body. And just notice those side to side. And then bring yourself back to center. Now let's close the eyes. With the eyes closed, let your awareness be in your spine, in your low back, in your belly, and then where your arms attach to your body. And pay attention, noticing, what do you feel? Do you feel enough of a stretch? Where do you feel the stretch? Can you introduce a little more stretch, raising the arms up a little higher? Maybe sliding the hands a little farther away from your body. That will accentuate the stretch as well. The eyes are closed. Let the lower jaw relax. Let's do a little more of the cervical spine, the upper spine, the neck spine. Let's get a little more movement there. Take an inhale. As you exhale, slowly let your head move in one direction. And then as you inhale, I want you to come back up to center. And then exhale in the other direction. And back up to center. Going side to side. Let it be with breath. As you exhale, you go to the side, and I want you to be very in your body here. This is the beginning of the practice, the beginning of the integration of the mind and the body, because creating stronger muscles and stronger bones, you need to pull and push strongly on them. And you need to be in tune with your body so that as you bend and load down into your joints or pull or push, you're in tune with where is the appropriate place for you to go. So you could go deeper safely and stimulate more strength and muscle building. Exhale into the stretch, inhale back up to center. Noticing if you could go a little farther now that you've done this for a little while. Noticing what's happening with your shoulders, your chest, your front spine, the belly, the lower rib area. You want to be in a place where you're feeling sensations. And then one more in each direction. And then bring yourself back to center. Lift your head, lengthen your neck. Let your arms go a little higher if you can. And then let's do a little movement here. So take your arms and slide your arms higher towards the wall behind you. Maybe you're actually able to get your hands to touch above your head, still touching the floor, or coming to touch each other on top of the blanket. That's your inhale. As you exhale, slide your arms along your body. Try to keep them as close to the ground, maybe touching the whole way if you can, pushing the elbows towards the ground and sliding the elbows towards your waist. Inhaling to bring your hands up above your head, either touching or touching your blanket. And then exhale, keep the elbows as close as you can towards the ground. That's going to deepen the stretch. Try to push the elbows towards the ground. Either they slide on the ground or they're very close to the ground. Feeling the stretch in your shoulder, chest area. We inhale up and exhale down. Keep your mouth closed. Feel all that you're stretching. Increasing joint range of motion and flexibility in the joints is how we keep them safe and how we minimize pain in our joints, is creating space in the joints. Noticing the symmetry in your body. Do you feel more tightness one place or the other? Let your arms go a little farther from your body when you do this. Make the elbow be where most of the movement is and push your arms towards the ground. One more. And then bring yourself back to center. Keep your eyes closed. Take your arms alongside your body. Palms face in towards your body. Thumbs are up towards the sky. Inhale, lift your arms up. Palms face each other, leading with the thumbs. Keep the arms straight as you reach up overhead. Really push your fingers towards the wall behind you. You feel a stretch coming into the lower rib cage area or the belly. And then exhale to lower your arms. And then notice there may be a little wavering of your body on your blanket. Stabilizing muscles are activated to make sure you don't fall one side or the other. You're elevated here off the floor. And if you're on the blanket, the rolled up blanket, it's uneven. It's a round surface, so your body on right and left needs to figure out how to manage. So there's some core work, some spinal proprioception work taking place here. And then bring yourself back to center. Let's take the arms out to the side as wide as you can. Unbend the elbows if you can. This is your inhale. As you exhale, bring your arms up. And then inhale wide to open. Spread the fingers. Exhale back. Inhale, open. And back. And then one more. And then bring yourself back to center. Open up your eyes. We're going to do a little for the shoulder here. Now, having a blanket behind you is a good way to keep you from rolling over. So come to one side where the blanket is still behind you. You could feel it against your body. Then cradle your arm and your head in your arm. Take the upper arm and you're going to bring it forward so that the palm is down. Reach long. When you get in front of you, reach long. You're going to be stretching the muscles of the upper back. These are postural muscles. We need these muscles to be flexible and strong in order to support posture. You keep going and you reach up above you. Once you get above your head, you're going to flip your palm up towards the sky. That's happening in the shoulder joint. That's external shoulder joint rotation. And then reach long behind you, straight arm, palm is up. That's your inhale. When you come to your side body, you turn your hand down on an exhale and bring your hand forward the whole entire exhale. Rolling open in your shoulder joint, chest up towards the sky. One more. And then bring yourself back. So it's a lot of shoulder joint work. And my experience is in this position, even those with shoulder issues, because gravity is pushing that joint and stabilizing it and supporting it in the socket, it's a really nice way to bring movement into your shoulder blades safely. However, you need to determine if that's safe for you. Let's go to the other side. So you roll all the way off. The blanket is at the back of your body. Your knees are bent. You're going to cradle your head. Take your arm overhead. Exhale. As you inhale, you turn your palm up towards the sky. The blanket is there behind you to keep you from rolling all the way over. Your arm is still off the ground. Your palm is up towards the sky. You feel that stretch in the shoulder. When you get to your side body, rotate your arm, palm down, and then reach your arm far in front of you. Really push far in front of you to stretch that upper back area. And then when you come overhead is when you begin the inhale. You exhale, palm down. You inhale, palm up. Palm is down. Palm up. Inhale, open. And then one more. And then rest. Now coming up from the ground when you have osteoporosis, or even if you don't have osteoporosis or osteopenia, but preserving the upper back and neck here, use the pushing muscles. Take this opportunity to keep your upper body strong when you come up from the ground and bring yourself all the way up. So that was a nice opening sequence for the upper body postural muscles, because posture is a critical aspect to bone health. It's what will keep your spine healthy. It also helps for fall prevention. Because if your head is forward, if your body is forward, you already have that much weight in the forward motion. It's a lot easier to go into that continued pattern of forward when that happens. Let's take the blanket, bring the blanket into a folded position so you can support your knees. If you have knee issues, get pads or get even more blanket. Coming onto all fours, spread your fingers, try to be aligned here with the hands underneath the shoulders, the knees underneath the hips. So starting to weight bear in the hips here. Take one foot back, flip the toes under, push through that heel, feel the calves, feel the back of your body, and your gaze is forward. So look forward, your head is above your torso, which means now we're strengthening those posture muscles in the upper back. Bring the other foot back, flip the toes, really reach through the heel here, pushing through the heel, head is lifted and looking forward. And then moving yourself, the toes are bent, you're moving through that heel, push the pinky toe into the floor a lot. And then go ahead and bring yourself up. Weight bearing, that's weight bearing. We hear a lot about weight bearing. Yoga to me is the perfect because we're using body weight, so we know we're safe. And then we can challenge our joints by bending, by moving our limbs away from our body, and weight bearing even deeper in joints in not their normal lined up position. And we work on the normal lined up position, the alignment, because that's critical for bone health and for breakdown, stopping breakdown of the body. Take your wrists and bend your wrists. Now here in this kneeling position, we're putting pressure in the hip socket here. So let's come into a little challenge right away with the hips, coming into a side challenge. You're gonna come back onto all fours. We're gonna go to the left side first. So I'm gonna show you, this is my right side, but I wanna show you. The knee stays on the ground and you slide your lower leg away, but the knee still stays on the ground. So slide the left lower leg away from you. Keep the hands underneath your shoulders. And then you're going to open up your hips to face forward and take your right foot, the big toe edge of the right foot onto the floor. So take the big toe and be right alongside your body. This is important. Make sure when you're lined up to the side, you don't have your foot forward. If you have your foot forward, it's very hard then to lift the leg. You've got to keep your leg in alignment with the side of your body. So bring the right foot in alignment. And then from here, lift the right leg up if you can. Try to lift it as high as your body. And there's a lot of balance challenge here. Take that left hand, put the left hand or the right hand on your waist, and push the right elbow back. Or you can bring the right arm in the air and push the right arm back. So now that left hip, we're on the side of the hip, pressing into the pelvis with the hip bone, with the leg bone. That's going to strengthen the bones because of compressive force, and it's strengthening the side muscles. Here, you're strengthening the side muscles of the right leg. You're lifting up against gravity. These muscles are holding the weight of your leg up against gravity. Keep that leg lifted, pull the toes towards you, reach through the heel. Do your best, do whatever it is you can do. Take one more breath, and then go ahead and bring yourself out, bring yourself down. Probably feeling both sides, the one that you're lifting here and the one that you're rolling into. Now, we don't normally roll into our side hip joint. So this is, I'm going to tell you, this is one of the postures that in live classes, people struggle with. It doesn't look challenging. It's called a modified balancing half moon posture. There's a lot of struggle that takes place. So if you're struggling, you're not alone. It takes time to build up the range of motion and the strength. This is the side body where not a lot of attention gets placed, and very important, very necessary. Take your hands in front of you. We're going to go to the other side. Now you're going to slide the right foot off to the side, and you're going to come up onto that right knee, that right hip, and let the left leg be alongside your body. Left arm is on top. You're either pushing your elbow back or bringing your arm up and pushing it back. That'll help you. And then lift that left leg off the floor. Pull the toes towards you, reach through the heel. Keep the left leg lifted and keep it active. Keep pushing the leg back so it's not forward, because the forward, as something is forward, your whole body will go forward. And that's where the challenge is. If you want to get successful at doing this, balancing half moon, the leg that you're balancing on, lots of compressive force in the bones, lots of muscular action in the joints to hold you in this position. So this is what we do with our weight. We throw our weight around off center in yoga. And when we do that, we challenge the joints, we challenge the muscles, we challenge the bones. And you have it available to you always. You don't have to go to a gym. You don't have to spend hundreds of dollars. And you can do it anywhere and every day. Demand more, you will get more. And the more you demand, the stronger your bones will stay for life. That's our goal. Lift that leg, reach that arm up and back. Take one more breath. And then bring yourself out. Let's rest. If you could bend your knees, sit on your heels, come in a rest position. Take your hands, close your eyes, slide your shoulders back and down and push them away from your ears. Close your eyes. When you are taking a rest and you're focusing, your eyes are closed, you'll notice the heart rate. And when the heart rate's accelerated, it's because you demanded and used more muscles. That's how you determine the level of effectiveness when you're showing up to your yoga practice, when you're on your mat, and when you're working towards strength, being stronger, stronger in your joints, stronger in your body, stronger in your bones. Take one more breath. And then remember, you do what you can do. Let's move on. Coming into the front of the hip joint, the plank posture is a great way to strengthen the front of the hip. Now, if you need to do the modification, you flatten the toenails to the ground, you walk your hands forward about a foot so that your pelvis has to move forward and your core has to manage it in the air. If you need to modify, do that. Otherwise, let's come up and flip your toes under. And then take your feet pretty wide here. Feet are pretty wide, hands are pretty wide. Really spread the fingers a lot. And push through the heels. And then bring yourself forward. And then push through the heels. Push through your fingers, push through your toes. Moving forward and back, you're going to feel that load that comes into the wrists, into the forearms, into the shoulders, into the chest. When you push back, now push back. Bring your feet back to a hip distance position. And walk your hands a little closer if they got too far apart. And then really push back with your heels so you distribute your weight. Bring awareness to your pubic bone, the base of your torso. Let's activate the core. I want you to draw the pubic bone up strongly towards the lower ribs so that your pelvis tilts and you flatten out the low back. Keep your head looking forward. Don't round your thoracic spine. That's your exhale. Inhale to release. Exhale, activate your core, pull your pubic bone up, push your feet into the floor, push through your heels, strengthening the front of your hip joint, strengthening your quadriceps, your front muscle body, your front muscles on your body. Stay with me if you can, and if you need to come down, go to where you can do your maximum and then come down when you need. One more breath. And then bring yourself down, bring yourself out, close your eyes. Slow down your breath by breathing down to your belly. Really deep breath. Breathe down to your belly. Take one more breath. And then open your eyes. So the last two postures we did, the balancing half moon modification and the plank, a lot of attention in that hip area. The side hip, the front hip. So let's go down onto the ground and do a little bit of the back of the body, the bridge posture, where we're pushing away from the floor. And when we push away, we're activating that posterior chain. So we have the glutes, the hamstrings in the lower part of the body. And then for posture, we want to strengthen the upper part of the body, the back muscles, the upper back muscles to help hold us upright. For spinal health, for fall prevention, for fracture prevention. So take your blanket to the top. For this, you're going to need a strap and a block. So get your strap and block handy. Bring them to the side. Now, when we do the bridge, if you have a loop, if you have the ability to loop your strap, it would be nice to do that before you come down onto the ground, would be to loop your strap. And don't go down on the ground yet. So loop your strap, or you could tie it, or you could do this without a strap. So let's come on to our buttocks. We'll do a posture on our way down. And this is actually going to strengthen the hip flexors. So the hip flexors are the muscles in the front of the hip. These are the muscles that bend the hip. And one of them is a quadricep. So as we're working on strength for our hips, we want strong legs. We want to work on the hip flexors. We're going to do what's called boat pose or navasana. So take your body and walk it side to side so you feel the connection of the sits bones, the base of your pelvis on the floor, and bring your legs here, and then bring your legs all the way up. So come into boat pose. Elbows are out to the side. Now the goal here is to push the heart towards the knees and the knees towards the heart, using the core to do this. The core is the base is the pelvic floor. Then you have the corset-like muscles of the obliques, and then the upper part is the diaphragm. So push the lower ribs towards the back, draw the pubic bone up, and as you draw the pubic bone up, really pull your knees towards your chest. If you're able to take your hands off, challenge yourself if that's available to you. Or one at a time, or hold on with a finger. Really reach your chest up. Push your chest up, pull your knees towards your chest. Let's take one more breath. And then bring yourself down. Before we go all the way to the ground, let's do stretching the inner thighs, Baddha Konasana. Take the soles of the feet together. Hold on and have a really nice tall spine here as you push with your muscles the knees towards the ground, stretching those adductors, the inner thighs. And part of strengthening our body is when we pull, so legs out to the side, you're pulling on your inner thighs. To deepen it, you bend your hips a little deeper, not your spine. So be very conscious and cautious when it comes to bending forward. Take one more breath. And then bring yourself out. We're going to come down onto the ground. Bring yourself to the side. Take your arm long and come all the way down onto the ground. Take the blanket behind your head, move it up so it is only behind your head, and then press your arms into the ground to lift your rib cage up. Slide the shoulder blades towards the spine so those flat bones are on the ground. And then take your feet a little farther from your body than neutral. Tilt your pelvis back to flatten the low back onto the ground, and then rock forward. Feel this pelvic tilt. You tilt your pelvis back, you flatten the low back, and then forward. Bring your awareness to the base of your spine, your tailbone, your sacrum, and your low back. And as you tilt, you rock through the tailbone, the sacrum, you flatten the low back, top edge of the pelvis. Do this with breath. Inhale to release, exhale to contract, tilt backwards, flatten your low back. Inhale to release, and exhale, tilt back, flatten that low back. One more. Warming up the pelvis, warming up the lower lumbar spine, warming up the low back, and then bring yourself back to center. Draw your toes towards you, your heels dig in the ground. Hold on to the side of your mat, underneath your mat with your hands, thumbs on top. Tilt your pelvis back, inhale. As you exhale, push your feet into the floor, squeeze your tushy, lift your tushy up, and you're only gonna go to the lower ribs. If your feet are far enough away from your body and you're tilted back, you'll limit that range of motion to come up and then bring yourself down. Exhale to rise, squeezing your tushy, inhale to lower. Don't let your knees move out to the side. Keep your legs static. You're really using the glutes, the hamstrings. Draw the toes up towards you. If you experience cramping, some of the reasons for cramping are mineral imbalances, dehydration, and tightness. And I'd say more often than not, there's a mineral imbalance and dehydration. Squeeze the tushy, push the tushy up towards the sky, and inhale to lower. Exhale to rise, inhale lower. You should feel heat probably right now in the glutes. And then bring yourself up, little pulses, pulse up. Hamstrings are getting worked, glutes are getting worked. If you'd like, you can even bring your hand here and feel the glutes, especially the glute minimus, the tiny glute that attaches right at the back where the leg bone goes onto the pelvis. Go to the place where you feel heat or burning, then you're in the muscles. Weight bearing, lifting off, pushing away from the ground against gravity. One more, and then bring yourself down. Shins, you might feel the front of the lower part of your leg with the toes pulling up, then feeling that heat in your back legs. It's a great way when we do floor work to actually strengthen the joints. And that's really important for pain reduction, for moving your body more, and then having that strength when we come into the standing postures to stay in alignment when we actually challenge our body with more weight bearing, which is how we strengthen the muscles and then in turn the bones. Let's take the legs wide. So you have your toes off the mat and you have your heels on. You can hold on to your mat here. Tilt your pelvis back so your low back flattens. You feel the pressure at the back, the top part of the pelvis. You feel the lower ribs, the back pressing in. Inhale. As you exhale, squeeze and lift. Again, a limitation in range of motion. You're not going to be coming up too high, which is why we can have the blanket underneath the head. Exhale to lift, inhale to lower. Try to feel both sides equally. Close your eyes. Push the heels into the floor as you push away from the ground. So these are variations of a bridge posture. Strengthening the back of your body, and in this case now we're strengthening the hip in this wide leg position, which is really important for fracture prevention. Then bring yourself up, little pulses. Feeling the heat in your body. If you go to a cramp, try to push the toes into the floor more than the heels. Feeling that heat. Take one more breath and then bring yourself down. Let your knees fall in towards each other, hands on your belly. Close your eyes, catch your breath. Noticing, feeling, experiencing. Take one more. And then go to open your eyes. Take your strap. Actually, leave the strap. Let's do the block for a second. Take your block. Now we're going to come up into a supported bridge. So I want you to have very little blanket or no blanket behind your head. So if you do have a lot of blanket, meaning you've rolled it really thick, put it to a very, very low level because we're going to lift our pelvis up and you don't want downward pressure in your head or neck. That's very dangerous, especially if your head, you have your chin up towards the sky or pointing backwards. You want to lift your head, lengthen your back neck. Take your block, walk your feet as close as you can get them to your body, come up off the floor, put the block underneath your pelvis. And then I want to tell you that for those of you that are newer to the practice, for those of you that are protecting yourself for whatever reason, you have something going on, this right here is a beginning way to come into the bridge posture, is to start with your body on the block, elevating your pelvis, starting to get that lift in your body that will then allow you to get more of a back bend in the thoracic spine. So if that's you, you do what it is you need there. Lift the head, lengthen the back neck. Now bring the arms alongside your body. Slide the shoulder blades towards each other. Walk your feet back a little closer. And your feet are pointing forward, your toes are pointing forward, not out to the side. So find yourself in the best aligned position possible. From here, you're going to inhale and then exhale. Push your feet in, squeeze your tushy, and lift your body off the block if you can. And it's not about how far you get off. Then I want you to push your arms into the ground so that you lift more of your rib cage and bend your rib cage and open the front of your rib cage. Push your feet into the floor, lengthen your knees away, try to unbend the front of your hip. Push your arms in to help you. Really dig those arms into the ground so that you're lifting the rib cage, you're pushing the rib cage up. You're getting that bend to come into your spine, stretching the front of your spine. Really push your arms in to work on the muscles of the back of the body. Deep breaths here. This is bridge. Push your feet in, squeeze your tushy, push your arms, bend your spine, stretch the front body. Take one more breath. And then you're going to slowly, slowly bring yourself back down. Put your pelvis on the block. Let your body relax. Let your body soften. So we're going to do another bridge. We're going to do it with a strap, which will allow us to get higher and more of a bend. If you're newer or you're protecting your body in a certain way, this might be the one you want to choose again. If you want to do the other, you're going to take the block out from under, get the strap, and put the strap on your feet. So you might need the blanket here underneath your head to help you, or you could lift your head up and you put your feet through the strap so that the strap comes to the top part of your thighs, right below the knees is where the strap comes. And then you prepare yourself for bridge. So this here now, when we're pushing out, activates that lateral chain. And so you're bringing more muscles into your body to control the pelvic area. And that allows you to then start to bring more of a bend into the upper spine. So we get a little higher when we use the strap. Dig your arms in, lift your rib cage up to align the upper body. Lift your head, lengthen the back of the neck. So the arms can stay in the bent position or straight position. Walk your feet closer, push out in the strap. Tilt your pelvis back. Push your feet into the floor, inhale. As you exhale, push your feet in, squeeze your tushy. Push your arms, push your feet and your buttocks to lift up higher to get more of a bend. So you could keep your arms straight, or you could clasp your arms and slide the upper arms underneath a little more. Really make sure you're pushing the arms into the ground as well. That helps open up the top of your body. Push your arms in, stretch. And then really push out on the strap if you have it. Really squeeze the buttocks. Stimulate, activate the lower body. Push your arms into the ground. Push out on the strap. Push your feet into the ground. Push your feet in, push your arms down, push out on the strap. Take one more breath. When you come down, if you come down slowly and lift your heels off the floor, letting the rib cage go down first, pushing the vertebra down towards the ground, heels are up. Tilt the pelvis back, stretch the low back as you lower down. Try to push your vertebra down towards the ground before you let the pelvis touch, really lengthening and stretching those lower back muscles, those spinal muscles, core muscles, support muscles, till you get all the way down. Then grab your blanket, put your blanket underneath your head. Take your strap off, props to the side, draw your knees into your chest, and rock side to side. Then bring your feet up towards the sky. So a happy baby will flatten the low back and bring some relief to your low back here. That's a lot of back work. So if you're feeling your low back, yeah, we've worked the low back. If you're able to reach up and hold on to the toes in happy baby with legs spread, try that. Only if the legs stay spread when you do this. Make sure your neck is nice and long. The eyes, the nose are pointing straight up towards the sky and not towards the wall behind you. Keeping that nice neck position. And then bring your knees into your chest. Let's come onto the side, using the strong muscles of the upper body to push away from the ground. So we talk about resistance training, pushing. We want to push using our pushing muscles. So we just use the pushing muscles of the back of the body and bridge to push away from the ground, strengthening the back of the body. In the plank, we're pushing away from the ground to strengthen the front of the body. So think about pushing away from the ground when it comes to resistance. And resistance training is what creates stronger muscles, and that in turn creates stronger bones. So bring your props off to the side. Blanket underneath your knees. We're going to come up through a little sequence that's going to strengthen the lower body. If you need to come up in a different way, you could come up differently. Take the hands wide, take the knees wide, take the feet wide, flip the toes under. Then push your body back, lift your pelvis up in the air. Take your feet, and it's one at a time where the heel goes down towards the ground. One heel at a time towards the ground. The gaze is forward. Feel that stretch coming into the back of your body. We need to keep limber joints, limber muscles in the back of the body so we walk properly, keeping that kinetic chain in alignment. And then bend your knees, walk your hands back until your heels touch and your entire foot is on the floor. And then you bring your forearms up, look forward. Really deeply bent in your hip joint here. So the hips are bent a lot. If you want a little more, you bring one hand and the other, really pushing back with your body. The weight is back, you could lift your toes up. Your feet are wide. If they're not wide, walk them wider, as wide as the mat if you can. Reaching forward, looking forward. A little bit of balance in your hips. Keep them mobile, keep them strong. One more breath. And then you're going to bring yourself up slowly, feeling that heat in the legs, in the glutes. Bending down with your hips to get your blanket, to move your blanket up. So I like to practice near a wall because when I'm near the wall, I can use the wall to perfect my alignment. I can go a little deeper, or I can get support to go a little deeper. So I like to use the wall. If you have one, practice near it. So coming first into what's called mountain, stacking your joints, finding alignment. Have your big toes closer together than your heels and have your toes a little far apart. Spread your toes and then put your feet down on the ground. Look down, see if you can see space between your toes, or try to keep them limber. Try to keep them mobile. Really important for walking, for fracture prevention, for fall prevention. And then place the feet down. Take your hands down alongside your body. Push the ball of the foot into the floor, the toes into the floor, the pinky toe edges, the heels. Push the top thighs back, squeeze the glutes and pull the tailbone down. Hands down, hands back, spine long, head as an extension of your spine. Don't let it be forward, push the head back. Chin is parallel towards the ground, look forward. Eventually, when you start to get real comfortable in mountain, you could see if you could close an eye or another eye or both and feel the movement in your body. There'll be this tight or this slight movement as the body figures out where are you in the front, where are you in the back, where are you in the sides. And so let's do a little moving mountain. Bring your body weight forward, whether the eyes are closed or not. Bring your body weight forward, feeling the front body muscles align and activate, and bring your body weight back. Bring your body weight to the side and to the other side. So with eyes open or with eyes closed, moving around in the different planes so that your musculature has to respond. You keep your joints communicative, keep your body aware. And then bring yourself back to center. From here, it's great to come into a single leg balance. So let's push our body to one side, bend the opposite knee. Bring that foot either on top of the other foot, pushing the heel into your lower leg bone, or all the way up in between the knee and the ankle. Now, in terms of bringing the foot higher on the leg, it doesn't make any difference in the hip joint. And we're focusing on balance here, foot strength, ankle strength, hip strength, pelvic bone strength, that whole hip complex. Single leg balance, such a great way to strengthen our hips, to strengthen our balance, to work on fall and fracture prevention. And something we could do all day, every single day of our lives. We could come into a single leg balance. Start to make it part of your daily life, whether you do it during an activity, which is usually the best. If you partner this with something you do all the time, let's say brushing your teeth, washing dishes. Maybe we don't wash dishes every day. Maybe we do, but we definitely brush our teeth every day. So finding something, or if you heat up tea, this could be what you do while you're waiting for the teapot to boil. And then bring yourself forward, bring yourself out. Stayed a minute in that one, so hopefully you felt that heat developing in the muscles, helping to stabilize your body. Hands down alongside your body, coming from mountain to the other side, bending the knee, foot out to the side. Either you bring the foot on top of the other foot or to the side, whatever feels right for you. And then I want you to think about what are the activities you do every day that you could actually add a single leg balance. Could it be to the brushing your teeth or to heating up your tea? When could it be, or can you set a timer that you come into a single leg balance? Hands can be down alongside, bring your hands up wherever you need. Challenge yourself every single day. And if you challenge yourself in a controlled manner, then you have more play, more strength, more range of motion in your joints that moves towards the fall prevention, fracture prevention zone, which is what we need. We need more in that area. That's what we're focusing on, is being as strong and mobile and active as we can be for the rest of our lives. Take one more breath. And then bring your leg forward, bring yourself out, shake your legs. So I'd like to come into the chair, and I'm going to do this with the wall. I have a mat there, so I want you to, if you are going to do this, you want to make sure your sock can slip out from under you. So the chair posture is the body weight goes back and we bend our hip joints. So see how much farther back my pelvis is from my feet? It's not this. Make sure when you bend, you're not going knees forward and bending down, or knees forward and bending a little bit. You want it to be that you're sitting back. See how my knees are staying straight? The bend is in the hip joint. And then the knees can join. And then we bring the torso up. If you're coming to the wall, you could bring your legs together or close together. You slide down the wall so you feel your tailbone, you feel your sacrum. Go as low as you can. The lower you bend, the more forces you put in the muscles, more forces you put in the bones. Bring your arms forward and up. And then if you are near a wall, and I suggest you try this, we call this air chair. It's very helpful for low back. When you are at the wall, you could tilt your pelvis back to try to get the top edge of your pelvis to touch the wall. And if you're just beginning and you're protecting your back, actually having your whole back touch the wall and flattening the low back up against the wall can really stretch the lower back, working on keeping that strength in the quadricep muscle group, in the glutes, in the hip complex, which is what we need. And this can be great for low back relief, especially if you tilt the pelvis back, trying to get your body in this nice aligned position. Chair pose. Lower you go, the more intense it is. Take one more breath. To come out, if you do go down against the wall, you keep your spine nice and long. You could use your hands to bring you up, or you unload out of that if you came down into that from a standing position. So I'd like to stretch our quadriceps, which is a muscle group that doesn't get a lot of stretching attention. It gets work. We just did a lot of work today so far for this, so I'd like to stretch it. Now, being near a wall is really good because you can hold on. So let's take one leg, bend the leg, reach back. Now, for some of you, you may only be able to grab onto your pants, or you may be able to bend the leg enough that you could hold onto the top of the foot. The key is that the leg stays alongside your body, not forward, not out to the side, but right next. So you want to try to keep your legs right next to each other, not out to the side and not forward. So stretching your quadricep. It's the muscle group that goes over the hip and goes over the knee. And it's what we use a lot for healthy aging, to keep our hip strong. Take one more breath. And then bring yourself out. Let's go to the other side. To the other side you go. That's why the wall might be handy. You reach back. Try not to bend your spine to reach down to get your leg. We want to be careful. We want to be careful we don't collapse in the front of our spine with osteoporosis or osteopenia. So you want to be lengthening your body, bend, reach back. Maybe it's your pants, maybe it's the top of your foot, stretching this side. Push the kneecap down, push the thigh back, and keep yourself in alignment. Try to unbend that hip. Take one more breath, and then go ahead and bring yourself out. Shake your legs. Grab your block. So we'll do triangle pose. In triangle pose, we keep our legs long. And when we bend our body to the side, we do a lot of pulling on the pelvis and on the hip complex on that front leg side. The important things about triangle are you keep your body between like two sheets of glass. You want to be careful that when you come down into your triangle pose, you don't put tushy back, chest forward. You want to keep your body to the side when you go down. And if you start to push the tushy out and the chest forward, that's as far down as you should go. So pay attention to that. That's why doing that against the wall is really, really nice. So take your legs wide, keep your block in your left hand. We're gonna go to the left side first. And then again, the other part of this is the wider you go with your legs, the more different areas you're actually pulling on the pelvis, creating more dance or range of motion for fall and fracture prevention. So wide stance with your legs, lift the left toes up, keep the left leg straight, and turn the left leg without bending, without lifting it off the floor, to the left. And then the right heel moves away. Now you could feel your tushy on the wall here. Take your left hand on your block, push your pelvis to the right, start to bend the left hip, and then take your right arm alongside you. You're gonna bring your block onto your leg, and you may only be able to go down to here before your chest wants to start pushing away or you feel too much pressure on the wall behind you. So if you could go a little deeper so that you could bring the block on the floor to push away from that, try to get the rib cage on the wall and the pelvis on the wall. Feel that tremendous stretch in the front of the leg, or the front leg, and then the back leg. Push the pinky toe edge of the foot into the floor. Try to push your buttocks against the wall. Push your torso against the wall. Push away from the block, and then bring your awareness to your feet. Try to push them or pull them away from each other, like you're trying to rip your mat right down the middle. Really bend the hip, the left waist and rib cage. Keep them as far away from each other as possible. So left lower ribs really far away from left pelvis. Feel the stretch in your body, pulling on your pelvis, pressing, lots of compressive force in that front hip. Take one more breath. Bring your block with you, bring yourself up. Keep your legs wide, we'll go to the other side. Turn your toes forward, lift your right toes up, turn your right toes to the right, left heel away. Take your block on your hand, push your pelvis away from you so you start to bend the right hip. And then bring yourself down, keep your rib cage, keep your pelvis touching the wall. If you could go lower, it's because you're able to bend your hip deeper, keeping that space between the right lower ribs, the right top pelvis. Try to push both buttocks to the wall and your rib cage towards the wall. Long spine. Bending that right hip and feeling that tremendous tension behind the right leg. And then bring your awareness to the feet. Grab the floor with the toes, push the pinky toe edges of both feet into the floor to feel like you're ripping the floor apart, pushing your pelvis back up against the wall, rib cage to the wall. Take one more breath. And then bring yourself up, bring yourself out, come all the way out. Bring your legs together. So the next posture we're gonna go into is warrior two. Now we're gonna bend our hip. The femur bone, largest bone in the body, it's your hip bone, it bends at the top. This bone here goes down to the knee and all the way up to your pelvis, largest bone. And it's used to this, you standing up, and it's managing your weight. When we start to take the legs out to the side and bend and load in them, then we put tremendous weight bearing into those bones, into those muscles. And that's what's gonna happen in the warrior two. So I'm gonna do this near the wall because I'm gonna push the block and hold the block with my knee, which is going to use the side musculature of my body in addition to everything else that's happening. So a lot of work on the hip here. Take your legs wide, be near a wall if you can. Then to come into the lower body position, lift the left toes, left foot to the left, and then you're gonna be at distance from the wall where the block touches, the pelvis doesn't. And then you push away from the right, bend that left leg. Shoulders are forward, up, back, and they're down, arms are up. Really push that left leg to hold the block and don't let your left buttock touch the wall. Push your hands back, push your shoulders away from your ears, and then rip the floor apart with your feet, active feet. The lower you go, the more of a 90 you go, the more the femur bone goes away from your body and you're pressing down. Weight is pressing down with this leg bone as far away from midline as possible with a deep hip flexion, knee flexion. More intense work in the hip, in the muscles, in the body. Take one more breath. Bring yourself down, bring yourself out, bring yourself slowly up and out. Toes are forward, we're gonna go to the other side. Lift your toes up, swivel on the heel, lift your back heel up. Pushing away from that back foot to bend the front leg. Make sure you keep your torso here. You don't want your torso to go forward. So you push away from the back foot, you bend the front leg so you can get that block there. Make sure the right tushy is not touching. Go lower if you can, pushing away from the back foot. Push that leg to hold that block. Shoulders are forward, up, back, and they're down, arms are up. And then you can push your arms back to the wall as well, looking over that front arm. Squeeze the tushy, pull the tailbone down. So the tailbone moves down, you minimize that curve in the low back. Make sure your right tushy is not touching the wall, but your right knee is pressing that block into the wall. Lots of side hip capsule support. Active feet, don't let your arches collapse. Grab the floor, pinky toe edge, push your leg into the wall. Lift your heart, lengthen your spine. Take one more breath. And then you bring your arms down, bring yourself forward, come all the way out. Put your block down to the side. Bring yourself back into that mountain. If you're able to close your eyes and feel and notice the feet, notice the movement in your body, or minimize your gaze. Feeling and noticing what the practice feels like in your body. Do you feel strength? Do you feel alive? Do you feel your body, your muscles? Energy coursing through your body. Take one more breath. So we're going to go down onto the ground into the posture of integration called Shavasana. Because I'm at the wall, I'm going to do legs up the wall. Legs up the wall is going to deeply set the hip joint, letting the weight of the legs relax into the hip joint, relaxing the low back, especially if today during the practice you feel your low back more than usual. It's a great posture. It's called Viparita Karini, legs up the wall, one of my favorites. So I'm going to leave my mat here for that. If you have tight hamstrings, putting a bolster underneath your pelvis can help with this. This will also stretch hamstrings. So get whatever you need for Shavasana. So bringing yourself down in whatever way that you need. If you are going to do legs up the wall, I'd like to guide you because this can be a challenge. So legs up the wall, if you start with your body touching the wall, so you're tilted and your tushy cheek is touching, and then you lower down onto your forearm, and then come down onto the ground. The question I get asked always is, should my tushy be touching the wall? And the answer is no. For those that are really limber in the hamstrings, it might be yes, but for many it's no. You don't want to be too far away, and if you elevate your body, it could be a little nicer. And then the arms out to the side. The goal here is to let the body relax, let the integration of today's practice Find relaxation so your body could be stimulated in the building, repairing, healing zone. Focusing on your breath. Gently begin to deepen your breath. Start to move your fingers, your toes, bending your knees, drive your knees in side to side with your knees. Rolling all the way onto your side. Then from here, pushing yourself up to seated. If you're at the wall, use the wall to help support you in a seated position. We're going to close the practice with sound, so bringing the hands together at the heart. Press the hands to the heart to the hands. Close your eyes, let your awareness go up and down your body to notice whatever there is to notice at the end of the practice today for you. We'll close with a gentle humming sound. Exhale. Inhale. Bringing your hands up to your forehead, bowing forward in gratitude. Namaste. So every day do something. The research shows that 3 to 5 times a week, 30 minutes a time is what will support bone health. So if you do 3 times 10 minutes a day, that's 30 minutes. It does not have to be consecutive. It matters that you move, that you demand more every single day from your muscles, which will in turn make your bones stronger. All right, so how are we doing? How are you feeling? How was that? Beth, hi. Nice to see that you're here. Any questions, any comments, suggestions, go to debbierobinson.com. I have so much information I'm sharing these days. I've got a cooking class coming up this Wednesday on protein. Very important that we get protein in our body. Lots of great information. My podcast, new episode launches every Thursday. Today, talking about the second half of the top 100 factors that lead to bone loss, which means that there's hundreds of things we could do to stop it. All right. Thank you for joining me. Like if you like, subscribe if you're not subscribed, share it with a friend, listen to my podcast, Stronger Bones Lifestyle, share that, listen to that. Yes, you're welcome. Thanks, Carolyn, Claudia. Yes, I love the wall. I don't know if everybody has a wall, but I love a wall. Great. All right. I love that. Excellent session. Good. Well, your hips are happy, and happy hips won't fracture. One thing I want to share with you. So I have a lot of orthopedic surgeons that I work with, and one in particular, Dr. Andy Bush. So I spoke a lot to him this week. We're working on a project. We had about 5 hours of discussion. And I asked him, he's an orthopedic surgeon. I asked him about I said, did you repair hips? Fractures. And he said, yeah, that was my bread and butter. That's what he did the most. I said, okay, who was she? Who was the woman that was there with a fractured hip that potentially would die from that? And who was the woman that had a fractured hip that's going to be okay in a few months? And there was a correlation. He said the woman that was out hiking or practicing yoga last week, even if she's 80 years old, is not the woman that's going to die from this hip fracture. It's the woman that is fragile, that doesn't move a lot. So be the woman that if we do fracture, if we do bend, or if we do, something does happen, that we bounce right back, because that is what we have control over. And today, if you did this whole practice, you're on that path to being, he actually said, the woman that was hiking last week won't even fracture when she falls. So that's why we're doing this. Tell yourself that. Yes, Claudia, exclamation point. All right, thanks. Have a great time until I see you again in whatever class I see you in. Have a great day. Bye.